Hello everyone and welcome back to our channel. Today we have an important topic that affects many women, and that is heavy bleeding from fibroids. You're not alone if you're experiencing heavy menstrual bleeding from fibroids. So today we share valuable information, strategies and practical tips that will help you manage and stop the bleeding. Hi, I'm Dr. Sylvia. I'm a general practitioner and health educator with Ask Away Health. Here on this channel, we love to share health information that will let you learn more about your bodies and help you feel and be better. So please give this video a like and consider subscribing to the channel. And when you've done that, make sure you follow us on all our social media platforms, Twitter, Instagram, Facebook, at Ask Away Health. Before we dive into these solutions, let's quickly understand what fibroids are. Fibroids are non-cancerous growths that develop in or around the womb. They're so common, it's thought that between 20 to 80% of women will have a fibroid by the time they are 50 years old. They can cause heavy and prolonged menstrual bleeding that can lead to discomfort and inconvenience in a woman's daily life. Okay, so now let's talk about some practical ways to stop bleeding from fibroids. The first I'm going to talk about is hormonal and non-hormonal drug treatments. One way to manage fibroid-related bleeding is by taking either medication that is hormonal or non-hormonal. Non-steroidal anti-inflammatory drugs like ibuprofen or naproxen are non-hormonal drugs which can help to manage pain that is associated with fibroids and help to reduce the bleeding from the fibroid. Tranexamic acid is another good medication that is non-hormonal, which can also help to alleviate the symptoms of heavy bleeding from fibroids. It's a drug that reduces heavy bleeding by promoting the formation of blood clots. So it's important that you speak to your medical professional before taking this to make sure it is suitable for you and will not interact with any other medicines that you may be taking at the same time. Next, birth control pills or other birth control medication, for example, the progesterone containing intrauterine device or coil. These are hormonal methods which can help to regulate your menstrual cycle, thereby reducing the pain and bleeding associated with fibroids. Other hormonal options include GnRH analogs, which temporarily induce a menopause-like state in order to shrink the fibroids. This hormonal method is often used before surgery for very big or bulky fibroids because it helps to shrink the fibroid temporarily, making the operating space easier. And as they shrink the fibroid, they can have a good but temporary effect on managing the bleeding. Esmaya is another hormonal medicine that is used for treating fibroids, either because they are very severe symptoms that have not responded to other forms of treatment, or in women who are approaching the menopause. The next strategy includes non-surgical procedures such as interventional radiology. The first example is uterine artery embolization or UAE. You can use this if you have moderate to severe symptoms of fibroids like heavy bleeding and you're trying to avoid surgery. It tends to be a more long-term solution than some medication options. It's a minimally invasive procedure where tiny particles are injected into the blood vessel that supplies a fibroid. In this way, it cuts off the blood supply to the fibroid, making it shrink, and this can alleviate symptoms like heavy bleeding. You must consult a specialist to determine if you're a suitable candidate for a UAE.